The Mouth Body Doctor.
Root canal treatments are performed when the pulp inside the tooth has died or is dying, usually as a result of either the ingress of bacteria associated with decay or cracking or fracture of the tooth. The dentist aims to clean out all the root canal system and then obturate it using a rubbery material and a cement. This is challenging in itself as the canal system is very complex with lots of interconnections, additional canals and lateral and accessory canals, which make the job almost impossible. However, the insurmountable issue appears to relate to the structure of the dentine itself. Dentine is composed of millions of tiny tubules, which in health are occupied and maintained by the cells that form the dentine, known as odontoblasts. When the tooth has died or been root-filled, these odontoblasts and their supplying vessels and nerves die, and when the tooth dies or is root-filled, the conditions within the tooth change radically from aerobic to anaerobic. Any bacteria within the tooth morph into their anaerobic forms, reproduce prolifically, and produce extremely noxious toxins. The tooth effectively acts as a microbial hatchery, since it provides nutrients, moisture, and incubation at body temperature, but critically prevents the immune system from tackling the source, since there is no circulation to the tooth. The bacteria and their toxins leach into the surrounding bone and membrane, and the pumping action of the tooth within its socket when chewing causes dispersal into the circulation. In this way, the tooth acts as a focus of infection, which can infect and poison the rest of the body. Every root-filled tooth has been found to contain at least 10 species, and some in excess of 40 microbial species, but it is probably the toxins they produce that represent the greatest issue, some being 1,000 times more toxic than botulinum toxin. In addition, retention of a dead and infected body part can exhaust the immune response, leading to autoimmune diseases and chronic fatigue, and can affect meridian flows, and there is a particular association between root-filled teeth and cancer.
Dr. Allison Adams is the Mouth Body Doctor. Holistic health from top to toe.